Rollator walkers. Our rollator walkers come in blue or red. These units are adjustable. You want to size it by making sure when your arms are straight down to your side that the handle is hitting your wrist area. This allows for about a 20 to 30 degree bend in the elbow, which allows for a comfortable walking position. So when you walk with a rollator, you're just going to push it in front of you, and you're just going to take one step at a time and walk yourself into the walker. The rollator has a flip-up seat with a basket to hold items that you may need while you're walking. If you're at home, you can put your cell phone in there, TV remote, a bottle of water, etc. And it will carry small items if you're out and about in public. When using the rollator walker, if you need to take a break and you have to stop, what you want to do is you're going to push down the locks just by pressing on the handles until it locks into place. And that locks the back wheels so the back wheels do not move. From this position, this is whenever you want to sit down, or if you're getting up from a chair or a bed or any seated position, you want to make sure you lock the wheels of your rollator. And then whenever you sit down, you just want to make sure you hold on to the rollator and gently set yourself down. From here you can sit and talk, do what you have to do, take a break. When you're ready to get back up, make sure locks are still locked, and then you can stand yourself back up and come back around. Then when you're ready to start walking again, release your locks and begin to walk as you did before. To adjust the height of the arms of the rollator, the screw knob here on the side will loosen and the cap will come off. There's a washer, and you just pull the screw out, and then you raise this up or down depending on your needs, and you put your screw back through, washer, and your screw cap there, and that locks the armrest into place. You can do the same thing on the other side so that they are level. Safety-wise, you want to make sure you avoid any throw rugs in your home. So if you have throw rugs, it's best to lift the throw rugs. Any part of your house that has a transition from carpet to vinyl flooring or hardwood flooring, you want to be aware of that. The number one safety issue you don't want to do with a rollator is when you put this into the lock position to sit, you sit down. This is the only thing you should do in a rollator walker when it's locked and you're seated, is just sit. Do not try to propel yourself across the floor. If somebody was to do this and they start to propel themselves like this, these wheels are swivels, so sometimes they will get twisted like that, and now it's not a safe way to sit, and it can tip you backwards and you can crack the back of your head. That is especially dangerous if you're out and about trying to wheel yourself around like this. If you hit a transition in your house while you're pushing backwards like this, you will fall backwards. If you're outside and you hit a curb or even just a lip in a sidewalk, you will fall backwards. So do not propel yourself in a rollator walker like this. It is only to be used with the wheels locked and in a seated position. It is not a wheelchair, it is a rollator. So every time you get up and down, make sure you're locked, and do not release the locks until you have transitioned back to the front of the rollator.